name is Sara, and tomorrow is my big day. I'm going to have the Auralyft and the brow lift performed by Dr. Talei. And right after, Dr. Jason Emer will do a PRP, a microneedling, and a gel plasma. Obviously, I have deep acne scars that I've had since I was about 16, 17. I've done a few things over the years, but I guess the technology wasn't up to speed for the depth of my scars. And so I searched online and I saw that Dr. Emer was treating each scar individually. To me, he seems at the top of his game and he seems like a pioneer in a lot of different techniques and state-of-the-art technology. And something that really convinced me to have the procedure done with Dr. Emer is during the consultation right away, he pulled the scars right away, they smooth out. And so for him to say that and say, would you be open to a facelift and basically introduce a different doctor, that just put me more in trust that he really was looking for what is best for me. And so I was very impressed with that.
All right, so we just finished the first part of the case. The main goal for her was trying to improve the acne. The reason we did the brow lift along with the facelift is that she had excessively lax cheeks, and when you lift a cheek that high, as the incision for the facelift either has to be really long or you have to try to release a little bit of the temporal area to avoid bunching. Alternatively, what I like to do is do a brow lift, so we did an endoscopic brow lift, and the facelift was done second. We released everything in a nice, very safe and effective way. This type of facelift, which is a very advanced type of deep plane facelift, tends to lift the cheeks more than anything else can. So once you lift the cheeks for her, the acne scars, which kind of were collapsing like an accordion, it's atrophic scarring we call it, was stretched out again. So it's the most effective thing you can really do for acne scarring before you proceed to doing resurfacing. So right now, Dr. Emer is doing the next part, which is going to be resurfacing with the helium type Bovie. That's called the J plasma. And it's going to do a very, very deep and effective resurfacing on the anterior cheek. We can't do that laterally because we're risking the blood supply to the skin. So laterally, he's doing a couple other things with the CO2 laser in a very delicate way. With this type of procedure that she's getting, she's going to get the maximum benefit, and she's going to continue to improve over the next year as the plasma and the CO2 really take effect. And Dr. Emer is most likely going to repeat a couple needling treatments and things like that to really maximize what we can get out of her acne improvement. It's very, very difficult to get acne to improve with minimalistic procedures. With things like this, people can get huge improvements and look completely, completely natural to the point where their parents or their kids would have no idea the procedure was done once they're completely healed.
It's rare in this day and age that doctors collaborate and work together to get ultimate results. My friend, Dr. Talei, is an expert, a world-renowned expert in face lifting, neck lifting, and overall facial surgery. So when a patient comes to us wanting improvement in scars, but also has the signs of aging like loose tissue, lack of a jawline, a sagging neck, Dr. Talei and I work together to do these combination treatments of lifting and volumizing and retexturizing the skin to get the best combination together. In this day and age where everyone tries to do everything on their own, you can't be the best at everything. His specialty is lifting and tightening tissues that are sagging as we age, and also improving the look of the nose, the lips, and the eyes. That combination leads to an ultimate result. And for our patient today who had severe acne scars, we wanted to give her a significant improvement. And by lifting her skin and also using energy devices like radiofrequency helium plasma and fillers like fat, we're able to give her an ultimate youthful transformation that's going to look natural but be dramatic at the same time.
So it's been 40 to 41 days since I had the Auralyft and the brow lift. J plasma, PRP, and the microneedling, and the redness is slowly dissipating. So taking it one day at a time, and I can wait for day 60.